Okay, this video is going to be Rogers, that's me, Dr. Rogers' theory of back pain. You can call it in more detail the ischemic spine theory, but I call it the ischemic and the biochemical theory of back pain. I'm going to explain what really causes back pain. I've got an extensive background in dealing with the spine. I'm the best expert in the entire world on the spine. So I'm going to show you how this will work. And it's going to be like, here's a Copernican inversion. This is a great painting from 1872 by Jan Matejko, the great Polish artist of Copernicus. He's kind of like talking to God about, the heliocentric theory of the universe. And what I'm basically saying here is almost all spine imaging is focused on a disc herniation, a disc protrusion, disc extrusion. Does the patient need to go to the operating room? Should we temporize them with epidural steroids, etc.? And what I'm going to tell you is the vast majority of spine disease is due to spinal degeneration. I look at these things all day, every day, okay? So I've seen a million of them. All right, I'm going to show it how it all works here. Okay, and just to give you a little background, I've been involved in spine for many, 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 many years, okay? I wrote this textbook of interventional imaging guided surgery procedures, interventional radiology procedures. I wrote most of the chapters on spine. This is just me at one of these animal surgery courses. I'm going to show you just a couple other things here. I wrote this book many years ago, How to Cure Back Pain. It's a picture of my coach, Mark Schultz, Dave Schultz, Olympic champion wrestlers. This was the audio book for How to Cure Back Pain. Back in those days, I used to do my own audio books. Nowadays, I'm just too busy, and I don't have the time or the money to do them. But I wish I would, because it'd be better if I did them than I get the stupid computer-generated one, which is better than nothing, but it's much better if I did it. Then here's another book I wrote about the spine. Ischemic spine is the most common cause of back pain. And a couple key points. The disc is alive. It runs on anaerobic glycolysis. And it gets blood flow through this lumbar artery, which then has a branch going to the end plate of the vertebral body. And then from there, it diffuses by diffusion. The glucose gets into the disc. Disc runs anaerobic glycolysis, pumps out its waste products. They get carried away. But you need good blood flow to these end plates. When you get atherosclerosis on the abdominal aorta, you'll stenose, that means to narrow and occlude the lumbar artery, and you'll diminish the blood supply to the disc, and then the disc will fail. Okay. All right, here's my most recent book that I wrote on the spine. This is the best of my books on the spine, called Prevent and Reverse Back Pain, where I go into way more detail about all the different theories and more detail about what you can do to help yourself from it. But this is the most sophisticated book ever written in the history of the world on the spine. Okay, it's way advanced. The conventional doctors, they don't know nutrition, they don't know toxicology, they don't know epidemiology, they don't read like paleontology literature. So they just read spine conventional literature, which is just always drugs and surgery, drugs and surgery. So they're good at that, but they don't know this other stuff. And this other stuff is really good to know. All right, just to give you a sense, here's a spinal arteriogram. You can see, the catheter is catheterizing one of the lumbar arteries. You can see the blood flow all there into the spine. Here's a typical severely atherosclerotic abdominal aorta. See these every day. And as you can imagine, they stenose and occlude the lumbar arteries, which come off mid-height of the vertebral body, and that's going to diminish blood supply to the disc. Okay. When the disc is damaged, you'll start to get abnormal motion. This is a more severe example. So here's one vertebral body, the vertebral body below it, and the disc in between them. So a disc with the VB above, vertebral body above, and VB below, that's a spinal segment. When you have abnormal motion at that level, that's called segmental instability. This is simply, anterior displacement of the upper vertebral body. It's called aneurolesthesis. When the upper vertebral body is posterior displaced, it's called retrolesthesis. Okay. This is gaseous disc degeneration in here. This is some end plate sclerosis. Okay. These are just common findings of degenerative disc disease. Okay, so now here's a really important slide. If you're serious in learning about the spine, you might want to hit the print screen button and save this one right here. So the outer part of the disc, so here's a disc from a side view. There's a little annular fissure. We used to call them tears, but the tears has a, like an implication of a sudden injury, and it's not necessarily a sudden injury. But anyways, that's an annular fissure. So the outer part of the disc that's in the periphery, this is a cross section looking down onto it, is called the annulus fibrosus. Annulus fibrosus. And that is like a steel belted radial tire. Okay? And then the center of the disc is called the nucleus pulposus, and that's like a jelly donut. So it's like a jelly donut inside of a steel-belted radial tire. When the disc doesn't have good enough blood flow, lack of blood flow is lack of oxygen, that's called ischemia. The outer disc will dry out and crack, and then when it cracks, the nucleus pulposus can herniate through there. So that's a disc herniation. Okay? When the disc dries out, it'll lose height. To say dried out, you could say dehydrated disc. Usually the medical word that's used is desiccated disc. Okay? And it'll lose height. When you lose height, you're going to get stenosis in the foramen, where the nerve comes out through the side. Okay? So in a vertebral body, this will be the center of the vertebral body. It has the best blood flow. And this will be the lower end plate and the upper end plate of the vertebral body. These are really like related to cartilage in a growing bone. Okay, and because of that, they tend to have poor blood supply. You know, cartilaginous bone, endocrine ossification, all that stuff just tends to have poor blood supply in the end plates. So under good conditions, you have poor blood supply to the end plates. So you can imagine with all that atherosclerosis we showed a moment ago with the calcifications, you're going to get progressively worsened blood supply. Because, you know, we talk about the brain being injured by atherosclerosis to the arteries of the brain, the heart with atherosclerosis to the artery of the heart. You know, you get AFib, you get congestive heart failure, you have a myocardial infarction, a heart attack. In the brain, you have, you know, progressive cerebral atrophy, and you have strokes and stuff. So what I'm saying is the same things happen in the spine. People just aren't aware of it, but it's obvious. The same thing happens everywhere in the body where you diminish blood flow. Okay, but you got to know that steel-belted radial tire is the outer annulus fibrosus, inner part's like a jelly donut. And when you crack the steel-belted radial tire, the disc can herniate out. And you have to know that the disc is alive. That's an AO, academic orgasm. Okay, once you get that, you can start thinking your way through it, okay? On a T2 weighted MRI, I'll show you examples of what they all look like. This is sometimes called an HIZ, a high intensity zone, because it'll be high in signal, bright, like white on the scan. Okay, all right. Now, here's a guy who gave me some good supporting information. This is a very, very famous video. This guy right here is an MIT trained spine surgeon. His YouTube channel is called Gooby Doobie. I'll try to remember to put a link to the video below. So Gooby Doobie, he's I think he's Dr. Gooby, and his dog was Dr. Doobie. His dog is named Doobie, something like that. Anyways, the video is called "I was an MIT educated neurosurgeon. Now I'm unemployed and living alone in the mountains." How did I get here? Okay, this video got over over 18 million views. Basically, his experience was, he was doing open surgical procedures on the spine, and he noticed that if he would sometimes delay a case, like he was real busy or going on vacation or something, or the patient going on vacation, he'd delay the case for a couple of months. The patient, if they would switch to eating a plant-based diet, they'd walk a lot, get their sleep, manage their stress, don't smoke cigarettes, the patient would often get better. And he's like, gee, that seemed to work, you know, just about as good as a spine surgery. He also noticed sometimes he'd do the spine surgery perfectly, and the patient wouldn't get better if they had all the bad habits. So he came to have a big appreciation for the importance of the good habits. And that's what I'm kind of saying here is, my advice would be, if you got a lot of back pain, see what you can accomplish by optimizing blood flow through optimizing your diet, your stress management, avoiding things like caffeine, cigarettes, alcohol. You have to filter your water. I'm going to explain why you want to do all these things in just a little bit. But as a matter of fact, let's call this part one. I'm going to divide this lecture into a couple different parts because there's a lot of material here. But this is part one of preventing back pain, my, Dr. Rogers' theory of ischemic and biochemical spine degeneration.